Hi everyone, welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Now, today's topic, we're going to talk about what is arthritis and what are the symptoms of arthritis. Right? Now, arthritis happen. You heard a lot about arthritis, right? For sure. I'm pretty sure that you have friends, family, or even yourself, your partner, your kids that suffer from arthritis. Right? Do you really know what is arthritis and what are the symptoms and what type of arthritis that you suffer from, right? So, hi Veronica, how are you? It's 7:41 today. It's a bit late for me to do the I normally start a bit earlier, right? Today is actually Sunday. It's Sunday, right? Sunday morning in New Zealand, in Hamilton. I live in Hamilton, so we talk about arthritis today. So let's talk about what is arthritis. So arthritis is inflammation of the joints, right? So it can affect one joint or multiple joints. So which means where can it affect? It can be on the shoulder, elbow, it can be on the wrist. It can even in the finger joints, it can be a hips. You heard a lot of people, I have a hip replacement now. It's very, very common, right? Knee replacement caused by arthritis, that's common too, right? Ankle, arthritis in the ankle, pain in the ankle, and pain can be in the toes too, right? All this joint, that can form arthritis, and they can form in the spine too. A spine is made of joints. Let me show you what a spine is. So that's the spine. This is the joint, the hip joint over here. You see that? Hi, Dr. Abman, how are you? Okay, let's do this. I think I put it on the wrong channel on the Instagram. So let me change the channel because I'm supposed to do it on my clinic channel today. Yeah, all right. So this is the joint. All this joint on the spine, it can form arthritis too. Right? Veronica said Peru is Saturday there. Yeah. We are a day ahead for, we're the first I think we're the first country to see the sun and always ahead forward compared with other countries, isn't it? Okay. It's too early. I haven't had my lunch yet. So a cup of water. Hi, Emin, how are you? It's always good for me. All right. So those are the joints that we talk about that it can form arthritis, right? Multiple joints. Some are just one joint, right? In one joint. Okay. We'll talk about the symptom later. There are more than 100 different types of arthritis. Can you imagine that? More than just one or two. It can be hundreds. Yeah. So to be honest, to diagnose is difficult. Exactly what type of, you probably can come up with one. Take your name to name one of arthritis, because a lot of it just you can't tell what type of arthritis. They just call what is arthritis. Yes, with different causes and different treatment methods. So because different arthritis, as we see that gout arthritis treatment is very different with the osteoarthritis and different with rheumatoid arthritis. So different arthritis and the treatment will be different, right? And come to Chinese medicine, in some in some treatment will be the same. Like if you're using acupuncture, if you're using balance method acupuncture, it's pretty much the same area that you put the needles. But when it comes to Chinese herbs, it may be different depending on how you prescribe the herbs, you know. How, and when it comes to diet, you know, diet affect everything, you know. Diet linked to everything. In Chinese saying, you say your mouth, your disease is from your mouth. What does it mean? It means that the disease is linked to what you eat, you know, and what you eat is at a big effect in your whatever you suffer from. So this is real thing, right? So what are the two most common arthritis? Have a guess. I just mentioned it before. What are the two? Do you know what are the two most common types of arthritis? Give you some time. Hi YouTube, if you see me, please say hello to me. It's Sunday morning over here. So can you tell me what are the two? Can one reverse arthritis? Good question. Good question, Veronica. Very good question. I love it. Okay. Now, reverse. So let's say the most arthritis, common type of arthritis. One is osteoarthritis. The other one is rheumatoid arthritis. And to diagnose the osteoarthritis, I'll answer you the question, but let me finish with this two type of arthritis and a little bit more information for that, and then carry on. I'll answer the question of Veronica Wong. Can one reverse arthritis? Okay, and because I want to use those two as an example to talk about reverse, you know. Okay, now osteoarthritis. Okay, we know that it diagnosed based on X-ray, MRI. You're gonna see the change in the bone, the structure, you know, the way of structure. You know, you see the change in the structure. That is the main diagnosis of osteoarthritis. Okay, of course you use the symptoms as well, but the symptoms sometimes difficult, and the main diagnosis is actually using the X-ray. Then rheumatoid arthritis, you know, if in the fingers, it can change, you know, and osteoarthritis, it can change the structure, bone structure. And then how do you diagnose them? And rheumatoid arthritis, you have to get a blood test, and will have a we call it rheumatoid factor that in the blood, and that's how you give a proper diagnosis for it. Okay, and the symptom can be similar. Okay, both of the symptoms can be similar. Okay, now give you an idea. This is the idea. Patients say bone and bone, way off. That is more common on osteoarthritis. And I always ask patients, if bone and bone, why don't you feel the pain all the time? You know, if bone and bone is causing the pain, why don't you feel the pain all the time? Okay, that's one thing. That is why they say you have to have a replacement. Okay, replacement. So what you see in the medicines, disease, what you see under the X-ray may not be the truth. Hi, Jing. Jing, my colleague Jing just came out and show up and watching this live video. So Jing, say hello to me and give me a thumbs up. and share this video, more importantly. Thank you. Now, yes, I want you to share this live video, please, and give me a thumbs up. Okay, so my question for all my patients when it comes to arthritis, I say, well, it's bone and bone, right? It's also osteoarthritis, right? Then I ask them, why don't you feel the pain all the time if the pain is causing from arthritis? You know, so it's so bad in there, and they need, you know, they need heat replacement. But patients sometimes just feel pain in certain time, not all the time, you know, or some will have pain-free, not until they do something heavy or something that they shouldn't do, and they trigger the pain. Okay, so in this case, why tell my patient this? You know, I can't reverse the bone and bone thing, but what I can do is we can prevent the pain happen again. And sometimes you just need to manage it, how to manage the pain. And with acupuncture and Chinese herbs, you know, you may just go for a walk for 20 minutes and you end up with pain, right? For example, right? End up with pain. Then with acupuncture treatment, Chinese medicine treatment, we can treat it with symptom-free. Then you go for half an hour walking and there's no pain. But if you go for x-ray, look at the structure, it will be the same. The diagnosis will be the same. You know, you will see that it's still quite bad of it, the joints. But the good thing is you don't have pain. And to be honest, most people have arthritis, suffer from arthritis, but they don't have symptoms. You know, don't have symptoms. Have you ever seen that the joint structure change on the fingers? And in the end, rheumatoid arthritis, those elderly patients, they say, yes, I suffer from arthritis, and they keep going. You know, they couldn't pick up the cups. And I've seen quite a lot that the hand, the structure has changed. Many years after, they don't have any pain. They can do things without pain. Give you an idea. People want to get hip replacement. Hip replacement, how long does it last? 10 years. So if, hi Juliana, how are you? If the doctor, if you're too young of it, they won't suggest you. Unless you're very, very old. But if too old, they won't suggest it either. Because they do want to see, they worry about, what about 10 years? If you're still alive after 10 years and the pain come back worse, they can't do anything. You see what I mean? Because the artificial joint, you only be able to do once. I think I've seen people do two, but very rare. Okay, most people just do one. Okay, can GE acupuncture help? Yes, definitely GE acupuncture can help with arthritis. Okay, just the idea. Okay, I'm sorry that we can't say that we can cure and reverse completely, but we can make it symptom-free. And for arthritis, to be honest, for most patients is, you know, you have arthritis, but the most thing that you care about is no pain. I can do my daily duty activities. That is the most thing. And I tell my patient, you know, this is something that we can deliver to you. But if you put a cure, I'm sorry, we can't say that, because even though you have symptom-free, you go for x-ray, you see that that's still the same. And what do you want? And patient really, when it come to arthritis, they just want symptom free, right? All right. So what are the symptoms of arthritis? Okay, there's about 4 or 5 things that in arthritis. Okay, number 1, of course, is pain, joint pain. You know, the joint pain can be. Hi, Matt, how are you? I got some Drake Anna. How are you on Instagram? So joint pains, and while not just pain, stiffness, and I'll tell you, most of them come with stiffness first in the morning. How about the third symptom? That is swelling of the joint. Then, and it comes with difficulty with range of movement, right? Which means, I can normally do this pretty good. But now I could not do that. I can only do this and very slow, you know. So arthritis, most common arthritis is like when the weather is cold and it happened in the morning. The morning goes stiffness. As the day go and keep, one is when the weather's warmer, the morning's colder and towards the afternoon's warmer, then you feel better. Or when you move, if you keep moving, then it weigh off the symptoms, you know, and it comes back again. But some of them, no. Some of them is bad in an acute situation and the acute state. It actually, you may feel the pain, the symptom 24 hours. Hello, Holistic Solutions. Thank you for joining us. Where are you from? You must be an acupuncturist. Okay. Matt Sincock. Where you from, Matt? On Facebook. Okay. So let's keep talking. These are the symptoms, and some of you or some of the arthritis, you may experience redness in the skin. You know, the redness in the skin. The most it can be rheumatoid arthritis. It can be gout arthritis. Okay. We're going to talk about how to diagnose it, and we can talk about more about this. Okay. Oh, Miami, from Miami. Okay. Miami Beach. Acupuncture student. That's Holistic Solution. That's great. Good to know you, and nice to meet you too. Matt is actually from Aussie. Wow, good country. How are you, Matt? And are you guys back to work already? Okay. In the case of, like, we talk about the 2 most common arthritis, right? One is rheumatoid arthritis, one is osteoarthritis. Okay. In the rheumatoid arthritis, you may feel tired or experience a loss of appetite. Your appetite may decrease. You may not. Okay. If you're on, I'll tell you what. If you're on, what is the 技术? I can hear myself the Chinese, but I can't. What do you call it? The hormone therapy. We don't call hormone. I can't say the word right now. That is how bad is it when you keep talking in Chinese and turn it to English. You know, because I have to do Chinese live video and show the Chinese practitioner about this as well. And Chinese we call 技术. What do you call 技术? If Jing can help me about this right now. I'm so bad. I just suddenly forgot about the word. Okay. that hormone, you use hormone therapy, and if you put on hormone therapy, it can actually stop the pain and reduce the pain. And what happened is you put on weight. You won't lose weight at all. Okay, so same as in rheumatoid arthritis. In most cases, you lost weight, and you lost your appetite. But sometimes it actually put on weight. If you do the drugs, the side effect of the drugs, it make you want to eat a lot. Okay, we call open your appetite. Lift up your appetite and you eat a lot, and then you become overweight. And to be honest, in arthritis, and people want to get hip replacement, knee replacement. That doesn't help them. I've seen a lot of patients. Some of them, they actually get the replacement and they still feeling pain. And to be honest, some of them, they have great results. Very good results. And some of them they say, I regret to have a knee replacement because the pain even worse. Okay, and another case is because people get the big joint. You heard about the replacement, and I always ask my patient, if you have a arthritis in your shoulder, elbow, and wrist, and the finger joint, will you get a replacement? They say no, there is no option for them, but they do though. Finger joint, in some cases, I've seen one of my patients, they get and I think this was artificial joint in there. It had grooves in there. Very different. Okay, and I'll tell you what happened. You won't see artificial joint on those joints, but you see it in here and here. Not even ankle, not your toes. Okay, I ask my patient, what if you have this? Will you get a artificial joint for it, replacement for it? They say no, there's no option. Yeah, there is no option for it. But here and here, there are two options for that, and it's very common. And I'll tell you what. The reason that those are very common, because it's big joint and they can do it. And I tell you what, those pain unbearable, and it happen most worse than those. The reason of that is because your body weight keep put on those. Okay, this and this, they carry the most weight for your body, those two joints. Okay, so which means if you're overweight and you suffer from arthritis, one of the things that you for your treatment is lose weight. Yes, lose weight is difficult. It's not easy. Never been easy losing weight, but that is one of them. One of the treatment that they should do. One of the strategy. Now, you can do acupuncture. You can do Chinese herbs. You can do any drugs you want. But to really get rid of it, changing your lifestyle, losing weight. I know people say, oh, I can't do exercise because due to the pain. But I will tell you what, you don't have to do exercise to lose weight. You don't have to do exercise to lose weight. You just have to change your diet. What diet is that? I keep saying it again and again. Plant-based diet. Right? Okay. Now, if you suffer from arthritis, you may also become anemic. Okay, meaning your red blood cells counts decrease. Right? Or have a slight fever. Yes, you may get fever too. Okay. Severe RA, which means rheumatoid arthritis, can cause joint deformity. Deformity, which means the structure change, right? Especially in the fingers. Yeah. If left untreated, if you don't treat it properly, become deformity. Right? Those are the symptoms of arthritis. So simple: joint pain, joint stiffness, swelling, and decrease of range of movement, your activities, the range of movement decrease, the joint range of movement decrease. And for other type of arthritis, you may get redness on the skin, like gout. You may get very low energy, and even depression. Depression, anxiety with arthritis. Because some people in a lot of pain and they couldn't work. And life has become very, very difficult for them. Okay. And loss of appetite and feeling tired, and RA means rheumatoid arthritis, and in the end of RA, it will form joint deformity. Okay. And it may get fever as well. You may get anemic as well. And I'll tell you what, anemic, one of the biggest issue with anemic is because you eat too much. You have been having too much of drugs. What I mean drugs is painkiller. You know why? Because if you have a lot of painkiller all the time, it actually damage your stomach. And when your stomach is damaged, you can't absorb iron. You can't absorb nutrition properly. So your blood quality is less. And then you get anemic. So that is one of the side effects of painkiller. And think about arthritis. Arthritis itself may cause anemic, but if you take drugs for it, painkiller, hey, you double the chance to get anemic. And I've seen people, one of my patients came to me, and she came here for migraine, and her migraine is very rare. When it happened, she like passed out and like a stroke for years, and she keep going. Whenever it happened, at work or at home, when hospital, CT scan. Each time CT scan, none of the symptoms look like stroke, but it's not. She can't talk, numbness, half sight, and lost balance. Look like stroke, but CT scan stroke is not a stroke. And whatever. She came to me and she told me that her mother-in-law had 30 medication a day. 30. Can you imagine that? 30 medication. And what happened is, he told me her mother-in-law is in the hospital. Why is that? Because too much drugs. And one of the drugs is painkiller. And causing her stomach bleeding. Stomach bleeding. 30 medication a day. Can you imagine that? So as an acupuncturist and here in Chinese medicine herbalist, and I want to encourage you, don't listen to whoever put you on drugs, on the medication. If they tell you, yes, take this, and after a few days, a few months, few weeks, few years, they say, okay, now you need to take another one. Oh yes, here you go. When you take this one is try to protect you, protect your liver. This one is try to protect your kidney. You become worse and worse and worse. Then be smart of it. You need to pull yourself out. Find another solution. You need to ask yourself, why should I take all these drugs and other people are so healthy and they don't need any drugs at all? This is simple. If you don't ask your question yourself, if you want to suffer yourself, and that's up to you. That's up to you, right? Your health is your own responsibility. It's not mine. Unless you come to see me, I'm your practitioner, I'm your acupuncturist, then we share your I'll share the responsibility with you. But if you're on your own, that's your own responsibility. Even though you come to see me, your health is not my responsibility. I'm just sharing your responsibility, you know. So you need to know very, very clear. You are the one who's suffering, not the doctor, not the one who prescribes you medication, right? So I'm not saying they are wrong, because in their knowledge, in their knowledge, this is what they can do. But the thing is, they didn't realize that there's other thing that can help them. They help their patient. So when you see this live video, you need to know, if you're a patient, you need to know you can do a lot of things for yourself. Do not rely on drugs. When it comes to arthritis too, we free patient from drugs. When they suffer from arthritis, we free them from drugs. We free them from medication. Well, it's not easy. It's not just 1 or 2 treatments. It takes time, and everyone's different, and you have to change your lifestyle. If that's what you want, hey, go and get an acupuncturist and Chinese medicine herbalist to help you. Judy say absolutely right about this. Yes, thank you. Yeah. So this is important. I just sending out a message. This is what I think. This is what I do. The mindset is important. If you're acupuncturist, I will tell you what. They are not every acupuncturist or Chinese medicine herbalist are the same. They are not equal. For patient, people think about, acupuncture, you're all the same, because you're not all acupuncturists. Like your GP, your MD. For me, MD are all the same, because I don't know them. But I'll tell you, they are different. Some MD practice differently. What I say differently is they're actually very care about patient, and they really want to get rid of the disease rather than control, manage. Okay, so they actually ask patient to change the lifestyle, to change the diet, to manage the emotional. That's what we do. Not just giving drugs. GP are so busy, very busy, incredibly busy. They will see patient 10 minutes, 5 minutes. That's it. Patient come in, talk about it, prescription, here you go. This is the reality. Yes, definitely not all acupuncturists are the same. Yes. So if you're an acupuncturist, what kind of acupuncturist do you want to be? Ask yourself this question. Do you want to just patient walk in, you put stick needle in, here you go, that's it. Not talking. You don't actually tell patient what to do. That is wrong. I know patient come here for acupuncture, but what do they really want? Have you ever set a goal for your patient? So if you're a patient, you come to see us, we want to set a goal for you. We want to know what you want. If some patient only want, hey, I just need acupuncture to relieve my pain. I said, is that what you want? If that's what you want, that's okay. But most patients will think about, I just want to decrease the pain. I just want some pain relief. I said, well, why don't you just take painkiller? I don't like the drugs. That's one of the reasons. Yes, I did, but it doesn't work. Okay, I understand. If it doesn't work, so then you have to tell your patient. As an acupuncturist, I always tell a patient, well, we are here. We'll go through everything I say. We are here to help you. And our goal, we successfully help people to decrease medication, eventually stop medication and then just do acupuncture and Chinese herbs. Now, it's not a 1 or 2 day thing and 1 or 2 weeks thing. It takes time. Then eventually I know your doctor tell you that you have to live with your medication for your life, right? Until the day you die. It's true. Then I say, well, acupuncture, we're going to treat you 3 times or 2 times weekly. Then as we go, your symptoms is not that acute, it's not happening that often. The pain is not appearing that often. Then we cut it down slowly. Eventually, we stop acupuncture and Chinese herbs. You no longer need acupuncture and Chinese herbs. That's my goal. Okay. And I believe you need to tell your patient what you believe in. I believe no one needs treatment, no one needs drugs. You can live healthy with your your diet, your lifestyle. You don't need anything. And this is truth. Okay, this is our goal. I mean, is that what you want? If that is what you want, we can do this for you. We can do it together. You're not relying on me. I'm here guiding you. I'm here give you acupuncture, give you Chinese herbs to restore your organs function. Then the lifestyle changing thing is I'll give you information. I provide you information. I'll guide you to some books. You need to go and read it. Gain more knowledge, more information, because knowledge is the king. If without knowledge, you won't be able to get rid of all this thing. Because people around you is a belief. People around you and tell you this. Hey, don't eat this. Hey, this. Hey, you should try this. They are not doctor. They are not practitioner. But they give you, and even though they are not suffering for that disease, but they give you advice, and it becomes too much annoying. I know, I understand. Yeah. Okay. Do they say I always give them a good advice about lifestyle? Good on you, Judith. Can you do acupuncture without herbs? Veronica, yes. When it comes to acupuncture and arthritis, let's just say arthritis, not other disease. Yes, acupuncture is the best treatment, even better than herbs when it comes to pain. Yes, you can do it without herbs, but the patient must change the lifestyle. Okay, so we are here to get, because acupuncture can help the organs recover as well. But one thing is, if the acupuncture go in and the patient feel very tired and not responding very well, then you have to try other strategy when it's an acupuncture. If you don't know about herbs, what I mean other strategy is, well, we have G acupuncture, right? And you have Dr. Tan's method acupuncture. Sometimes Dr. Tan's method acupuncture is very good for it, but sometimes it doesn't work as well as G, or you can combine. And sometimes if you do those, it doesn't work. Scalp acupuncture may be the answer for you, or ear point, But acupuncture and diet be enough? Yes. Diet is the thing that you must do. Doesn't matter what disease it comes, especially when it comes to pain. I have a lot. I tell you what cases come to me. She came to me for urine problem. Okay, bladder issues. Then she put down the history, arthritis. I said, wow, you've been diagnosed with arthritis? Yes. They say, how is the pain? No pain. No pain? Strange. That was my very early year of practice. 1 or 2 years probably. I had no pain. Well, how did you do that? What treatment? Because I want to know. When patients say no pain, that's good. Well, do you know what she said? Do you know the answer? So she used to have a lot of drugs. I mean, medication, pain relief medication. The doctor prescribed for her. And she had it. Then they put on more medication. And the pain still comes and goes, comes and goes. And she didn't like medication because it didn't actually help her. Okay. She's still suffering from the pain. And ended up she need to take other drugs for it. Right. So what happened in here is she went for plant-based herself. No one guide her. No one guide her. Doctor didn't tell her about this. Obviously not me, because I didn't know her. Right? Not her. So I didn't know her. So she told me that that's what she does, plant-based and cinnamon vinegar every morning. I don't know the amount though, but just a bit of cinnamon vinegar in the morning in the water and drink it every morning. That's what get rid of pain completely. That's just one case, okay? But what did I learn from this case? I learned it straight away. It tells me that some arthritis, I'm not saying everyone though, some arthritis, they don't need treatment. They just simply change the diet, they heal without any pain. But of course, we need to, as a practitioner, we see a lot. Not everyone just change diet and all good. Because as a Chinese medicine practitioner, we know we need to make the organs healthy, the organs balanced. We see some patients become plant-based, they still suffer from arthritis. Why is that? Because emotional can cause the pain. Because the organs out of balance, and even though you in a good diet, you still suffer from the pain. But the pain would decrease. The pain would decrease. Okay. Remember I talked about yesterday. One patient had lung collapse, and she put herself on vegetarian diet. Just about vegan. The only thing that she didn't get rid of is cheese. No milk, no eggs, no nothing, and then she got much less pain. But pain still there. She came in still a lot of pain, but the pain is decreasing. Within 1 month, the pain decreasing, So same as here with arthritis, we encourage patients to change lifestyle, change diet, to manage their emotional, right? Those are the two things that's important. Then we use acupuncture to help the organs rebalance. Acute holistic solutions. Before 1, 2, 3, I definitely like to ask the patient how is the pain affecting their life. Yeah, what is their goal and what they hope to get out of the treatment. Good on you. Yeah. We have a form. Patient need to fill in all those things that patient fill in. We ask them about how important to get rid of these conditions. We ask them what do they want in 3 years time. 3 years time back there, what do they want? It's about the goal. And we ask them a lot of questions in there, not just we ask them what they want. And we actually ask them when they come in. I ask them with arthritis pain, what does it prevent you to do? Does it stop or slow you down to doing something? That's the reason they come to you. They come to you and say, oh, I have pain, I want to get rid of this pain. That is not a real reason, because a lot of pain, patients suffer from pain, they don't actually come to you. Why is that? Because they manage it well. Because the pain is not affecting it's not stopping the doing things. It's not slowing down the doing things. Not until the pain, arthritis pain, actually affecting, slow down their life or stop them doing things, and they come to you. That's something they want to do, they're enjoying, but they can't do now. because of the pain. That's what they come to you. So you need to find out the real reason. The real reason. Okay. Yeah. Veronica, I think acupuncture and diet in arthritis are good enough for that. Yeah, good enough. Unless they are very, very old and they have very, very weak, and you just have to take it slowly. Change the diet first and get the energy up a little bit. And some acupuncture is too strong stimulation. We don't use that. We avoid use that and put less needles and gradually build up the energy, the inner energy, the organs function. Then you can put more needle afterward, because more needles and it may decrease the energy. Okay, they may feel tired afterward. Okay, so that is what we call the resources not enough in the body. So you want to give them some resources. By changing diet is the best thing. It's the best thing. Yeah, plant-based diet. Okay, now I have a lot of patient. I have another patient that I can share with you on another day, that she had a lot of joint pain, and I give her acupuncture, GE acupuncture, and Dr. Tan's balance method, and it works very well. Fantastic, immediate results. But what happened is, unfortunately, the result didn't last. Okay, that happened. That happened. Not until she changed the diet. As soon as she changed the diet, the result lasts. So I'm here. If you're my patient, and because I'm doing this live video on Facebook and my clinic page. All right. If you're my patient, you see this. I always encourage you. Ever since the first visit, initial examination, we give you a plan. Every plan, including diet, and we film the video for you. And not every one of you doing the diet properly, and I don't force my patient to change the diet. To be honest, I let them understand why that's important. Okay, so if you want a patient, you need to take action to really read the book that I encourage you to read, the China study, then change your diet. If your conditions comes and goes, the result doesn't last what you want, then consider change your diet. So not all my patients change diet straight away. More patients change diet afterward. They get result. I prove that acupuncture work, Chinese herbs work, but the result doesn't last as long as what we want. Or I treat them, they get better up to here, now stable in here. We can't get any further. Then I encourage change the diet even further. Some start to change, but take times. They take it slowly. Light effect could be lower back pain, prevent the patient from picking up their child or play golf. Knee pain, preventing patient from doing their gun. Yeah, that's right. That's light effect. Yeah, light effect is the thing that you want to discuss with your patient. Patient will come in, I want to get some treatment for lower pain, back pain, or for my knee pain. It's not really the pain that get your patient in. You want to find out behind that. What's the story behind that? The real reason why they come in. Like lower back pain, just holistic solution. Say, the light effect can be the lower back pain, preventing patient from picking up their child or play golf. So it's the playing golf that they can't do now. Which means if they're retired, they may play golf 3 times weekly or every morning, and now they can't do it, and they don't know what to do. End up with pain, not enjoying it, annoying pain, So that may be one of the bigger reasons. So you want to treat them and get get them back to playing golf. This is the thing. So it's the same thing when we say about lower back pain, because arthritis can form in lower back. So you want to treat the arthritis, and I will tell you that most arthritis it actually form gradually, but some arthritis it comes suddenly. And I'll tell you what, people have X-ray. For some reason they went for X-ray, and the doctor told them that, hey, you have arthritis in your knee, in your neck, in your lower back. But the patient said, no, I don't have pain. And keep in mind, arthritis doesn't form in one day. It comes gradually. For those cases of X-ray that's been proved they have osteoarthritis and they don't have pain, what does it mean? Arthritis itself, if it's diagnosed, doesn't cause the pain. So what causing the pain? What is causing the pain? So this is the question for you. I'm not giving you an answer. We're going to talk about next time what causes arthritis. Okay, what causes arthritis pain? Right? Tomorrow we're going to talk about this. What causes arthritis pain? Yes. In Western medicine, they see that, or bone and bone, they say the bone and bone is for pain, but I always question it. We see the X-ray, say, oh, it's arthritis day, and people come and take an X-ray and the arthritis day, oh, I have been diagnosed with arthritis, but while I take X-ray, I have arthritis, but there's no pain. Thank you, Szenan. Very instructive. Have a great day. Yeah, you have a great day too. Thank you, Veronica. Now, if some of you at nighttime, good night, have a good sleep. And if some of you in daytime, I hope you enjoying your day. Okay, stay awesome, and I love you all. I'll see you tomorrow, Monday. I'm off on Monday too. Thank you very much.